Gender equity is a human right, and it is central to excellence in patient care. It lifts the economy and it makes our communities healthier and safer. This devastating pandemic has shone a spotlight on inequity, but has also given us a unique opportunity to put things right.
In this episode of Coda Zero, we discuss the issues of gendered inequity, how it impacts on healthcare providers and healthcare consumers, how it is compounded by racism, violence, and the pandemic. And we ask what each and every one of us can do, because each and every one of us has a role.
We're proud to collaborate with CommBank on this educational project about gender equity within medicine. We're excited to see the launch of CBA's The Next Chapter programme, addressing domestic and financial abuse.
I stand on Bunurong country. Chris is on Gadigal country, and our guests come from as far away as Powhatan country. We acknowledge the traditional owners of the land upon which we stand, and we pay our respects to the elders, past, present, and emerging. Wherever you are in the world, we ask that you take a moment to acknowledge the traditional custodians of the land upon which you stand.
Welcome to Coda Zero.
Welcome to Coda Zero.
I just want to thank Coda Zero for this fantastic panel that is made up of all women. Well done. Let's move on to Liz now. Now, in your role with the UN and chair of the Working Group on Discrimination, you see every day how the pandemic is affecting women and girls. What are you seeing?
Yeah, thanks very much, Jess. And can I first say that I agree with everything that Kate said, and also Lauren. So it's great to be here with everyone. What are we seeing as a result of the pandemic? And just to give you an idea about my global role, I'm now chair of the group of special rapporteurs who make up the Working Group on Discrimination against Women and Girls. So I'm looking at the status of women and girls in pretty much every nation of the world. And every night I'm receiving information about human rights violations that are happening against women and girls in so many different countries. I write to the leader of that nation, so to the Prime Minister, the President, the head of a nation state, drawing to their attention things that are happening and asking for the matters to be investigated. So in that role, I'm seeing that we have two opportunities here. We can create a post-COVID world which deepens the structural inequality and discrimination against women and girls, or indeed we can choose to do something differently. So it's presenting both challenges and opportunities. And just to give you an idea about that, 2 weeks ago I presented to the UN Human Rights Council, which is the UN's major body on protecting human rights across the world. It's based in Geneva. Ordinarily at this time of year, I'd be living in Geneva presenting in person, but this time I went in by video link, which I have to say was a pretty surreal experience. Everyone from the president to each ambassador speaking through a mask, and an eerie emptiness in the chamber, which is a chamber that's ordinarily filled with a lot of noise, sometimes a lot of hostile energy, but definitely a lot of chatter. So, and ordinarily I'd be sitting down the front of a chamber with a number of advisors responding to nation states. This time I was actually locked down here in Sydney with my dog on the couch. So I have to say it was not for the faint-hearted. But the picture that I came away with from there was absolutely clear. And this was in 4 hours of interactive dialogue with different countries around the world. And that is that this pandemic, I think as Lauren had said, it's exposed pre-existing gender inequalities. It's not that these things were new, but they've been shared, there's been a stark light shone on these inequalities. And they are, what I came away from that knowing is that these inequalities are becoming more deeply entrenched in every region of the world. And of course, not all women will experience discrimination to the same extent or in the same ways. We do know that women experiencing multiple forms of discrimination, so women of colour, migrant women, Indigenous women, women with disability or LGBT women, will be impacted to a much greater degree by this pandemic. And so what are we seeing? Well, we're seeing a dramatic increase in women's caregiving responsibilities, and Kate talked about that. I mean, with lockdown and quarantine, we have children out of childcare. We have more homeschooling. Particularly women are looking after elderly relatives because of their increased vulnerability, and everyone's in the house. So that domestic load goes up. And it's interesting to see that here in Sydney, with some research which will be released in the next couple of weeks from Professors Ray Cooper and Lynn Craig, that shows that here in Australia, before COVID, women were spending around 1.7 hours more per day on care and housework than men, 1.7 hours more. Following COVID, it's increased another 50%. So we know that women's unpaid care and domestic responsibility has increased dramatically as a result of COVID. The other thing we're seeing is a rise in an already epidemic of sexual and domestic violence. And I was just speaking to the CEO of Medibank last week, who tells me that their 1-800-RESPECT line, which is the call line here in Australia, the number of calls to it have increased 65% in the last few months as a result of lockdown. We're also seeing the continued feminisation of poverty. The fact is, in most countries of the world, there's a larger proportion of women in precarious work, in low-income work, in casual work. That's the case across the healthcare sector as well, when I look at aged care, early childhood education and care. So those women are losing their jobs at a much higher rate than men. And not only that, they're disproportionately represented in the frontline essential workforce of a pandemic. And as one commentator put it, he said, women deliver global health, but men lead it. And I couldn't agree more. We've just heard about all the statistics around that, and particularly not just in healthcare, but aged and disability care, cleaning, retail, teaching, early childhood education. So just two other things I'd like to say about the deepening of inequality is, where are the women in the national rebuilding and recovery efforts? The global efforts, the national efforts, they're just not there. They're very small numbers of women who are helping in the rebuilding, and that's worrying me, that we will rebuild nations where women will not be actively and intentionally included. And that'll be particularly the case if they can't access reproductive health care. As you all know, many nations are deeming, for example, abortion as elective surgery, therefore no longer available, which disproportionately impacts on poor women. And overall, I think it's jeopardising women's safety, well-being, their economic security and their ability to participate in political and public life. So they're the challenges. I mean, as the world gears up for recovery, there will be some opportunities. I see the opportunities for women, particularly in the technology area, because if we've looked at flexible work, working from home, those types of things, technology is enabling that more broadly. Technology is allowing women to collectively organise, and also the women's, particularly young women, their activism and their movements across movement building and whatever's being very much enabled by technology as well. So they're some of the issues around what's happening with women in COVID.
Elizabeth, you had a very large role as the longest serving Sex Discrimination Commissioner in Australia, and as part of that you established the Male Champions of Change group. You've also created a healthcare sector section of that organisation. Is it really a men's problem? Like, isn't gender equity a women's problem?
No, it's a great question, because for many, I think for many people, they think, well, actually, gender equality is a women's problem. It's women, and let's face it, it's women that's got us most of the rights that we have in the world today. The collective action of women, it's because, women that I will never know cared enough to demand change several generations ago. But I think when we just conceive it as a women's problem, our ability to make progress is limited. The fact is, this is a key economic and social issue, and we need men, because men have power, and this is about the redistribution of power, either in organisations, in nations. We need men with power to step up and take the message of gender equality to other men. And it's interesting, Kate was talking about how do we shift men who are leaders in healthcare. Well, that's very much where the Male Champions of Change strategy is about. It's about recognising that in most of our organisations, it's men largely, not exclusively, but it's men largely that hold the levers of power. So if we want to shift power, we need those men to work with us. And so we developed a group in the healthcare group. We actually started very small several years ago. We started with about 6 men. We now have about 260 of the nation's most powerful leaders. We've got groups also in Pakistan, in the Philippines, and the global tech group out of the US and the UK. But those men come together in small groups, firstly to learn about the complexity of gender equality, because it's a hugely complex area. So it's an incubator for them to learn, but for them to then step up and take strong action. And just to give you some examples of what the health group have been doing, I mean, coming back to Kate's point about conferences, it's so true. The fact is, if you want to have a strong career, you need visibility in public life, and that's speaking at conferences and other things. And what we're finding is that many conferences are all male speakers. So taking the panel pledge, that is, I pledge never to speak at a conference which has a man tell or where women's voices are not well represented, that costs nothing, and it's a starting point. That's one thing. Eliminating everyday sexism, calling it out, and men calling it out. Because the one thing is a woman to call it out, but another for a man of power to say, that actually is not working. One healthcare CEO recently told me he was involved with a group who were having a discussion in the workplace, and one of the men that was part of that discussion told a sexualized joke. Now, we've all been in that situation. He said what happened next was that the men laughed, and then all the women that were part of the conversation laughed, so he laughed too. And then when he went to those women subsequently in the next week to get some feedback, because that's one of the things you've got to do as a male champion, get feedback on how you're leading on gender equality, those women said to him, you know what, you're really letting us down. They said, remember when, that bloke told the sexualized joke and you laughed? He said, yeah, I laughed because you women laughed. They said, no, we women, we laugh because we have to fit in. But when you laugh as the leader of this organisation, you're absolutely letting us down. And I think it's those micro moments when men need to step in, speak up, and learn from those as well. As he said to me, Liz, what I learned from that is I'll never, I never want to be part of a conversation that I wouldn't be happy to have my daughter part of as well. So I think men have a really important role to play. And here in Australia, we're trying to accelerate change through the disruptive action of men.
Now, just briefly before we move on to questions from the audience, you presented findings of a 12-month consultation in the region of the world on women's rights in changing the world work. In your presentation to nation states, you said, creating a world of work where women benefit and contribute on an equal basis with men requires reimagining the structure of work and the economy, with women's human rights placed front and centre. What is good for gender equality is good for the economy and society as well. What does a world of work that benefits men and women equally look like, and how do we get there?
Yeah, so it's interesting to see, because the world of work as it's constructed now is one which was created by men, is largely run by men, and now we need to shift it. We need to shift it to ensure that women are central to the way work's constructed, not to preference women. But what we know is when women's human rights are front and centre, everyone benefits: men, families, societies, and also economies. So really the 5 things that we need to do to develop that world of work is, firstly, we need to ensure that freedom from violence and harassment, not only is it a basic human right, but it's a lived reality for everyone, but particularly for women every day. And that means prioritising prevention and survivor-centred responses to sexual harassment. And I'd say that's particularly in new forms of work like the gig economy. So that's important. The second thing is we need to redistribute unpaid care and domestic work between men and women. As I said before, at the minute, our economy thrives on women's unpaid domestic work. It doesn't come into our analysis of productivity or anything else. So what we need is an investment in care services, as well as universal access to a full range of parental leaves, maternity, paternity leave. So the better, and most importantly, the better sharing of paid and unpaid work between men and women. The third thing we really need to do is to disrupt patterns of women's and men's work. So at the minute, the healthcare sector is very feminised environment, and some other sectors are very, have predominance of men in those sectors. What we need to do is to disrupt so that both men and women can work in high value roles, from caring right through to really strong technical roles as well. And then we have to, the next thing we need to do is ensure that all women workers can enjoy their rights without discrimination, and that includes informal workers. In many countries of the world, women's work is in the informal sector, and I'm thinking there particularly about migrant workers who are working in domestic work, in care work. They have no access to social protection, so that needs to change. And then finally, I think we have to support women's collective action and organising, and that's just so important, and particularly so that women can actually be employed in decent work with terms and conditions. So, as I said, work that's on the back of women is currently sustaining entire economies, yet it remains undervalued and invisible. And without some concerted action, there is a significant danger that the current gender inequalities that we have will not only be replicated, but they'll be amplified into the future. And that's something we all need to do something about.
We have a question from the audience. You've been on the inside and closer to the power than the rest of us. How do we get those in power to listen to us?
Yeah, it's such a great question. And I ask myself that because you're right, because of my roles, I have been able to work within the, not the corridors of power, but within the institutions of power. And I think part of it is helping people see that the suggestions that we have, that the work we're leading to, is not about preferencing women above men. It's actually about lifting whole economies, whole nations. It's about lifting families, because, even in the family setting, and many countries of the world will believe that gender equality is destroying the very institutions on which their countries are based, including the family. They'll say they want to protect the family, therefore they can't engage in, women's rights. If you help people see that actually, particularly during this pandemic, if a family has two incomes, then one of the partners loses their income, the family's not thrown into poverty. There's an example of gender equality being protective of a family. When women are educated in the family, then it's more likely that their children will be educated. That's an example of building resilience into the family. So I think it's just coming back to working with, even from the family units right up to the country level, just helping see that it's not a zero-sum game between men and women, but this is all of us together lifting economies. We want prosperous economies. We want socially cohesive nations. And the work that we're doing can actually promote this. And at the end of the day, because you'll usually get three groups, one who are really on board, a bulk of group that sit in the middle who are saying, will we be able to just sit this out? The organisation says it's committed to it, but I don't really believe it. I'll just sit here and plot it out. And then you've got the ones who just don't get it at all. My suggestion to the ones that just don't get it is they either need to take their skills somewhere else than your organisation. But that middle group, you can really shift them by engaging them in the human story. So what is the harm that's currently happening in this organisation on our watch? The levels of sexual harassment, the levels of exclusion and mental health. Let's start telling the stories of the impact of a current culture, because it needs to shift to be more inclusive of women. And, those men particularly, and also women who have power, need to use their power to shift that organisation. So I think we need both a head and a heart connection. That's the way that I've learned it's the best to move people on.